life, or at some point you will be treated entirely?
So it depends on the cause of the diabetes. If it's something that is reversible, then
What will make it reversible then?
so there are cells within the pancreas that actually secrete the insulin. Okay, these cells, depending on what is causing them to be destroyed, if it's an infection, if it is if it's a stone that is lodged in there, if it's a pancreatic tumor or any other thing that may be causing the problem, if you're able to identify the source and you reverse it, the beta cells are able to recover. And then in that case, you may be off the medications. But that happens in in quite a few patients, okay, where the process is reversible. For most patients, the process is progressive because most of their beta cells are not able to recover to be able to let them function well without the help of medication or even insulin. Okay,
At what point do people get diabetic wounds?
it usually develops as a complication of the diabetes. If it is poorly controlled, the high levels of sugar in the blood will first cause their joints to be deformed. It will cause them to lose sensation to the foot. So the little cut they have or the prick they have on the leg, they are not able to notice it. The muscles of the foot are such that they keep the foot in a particular arch. But with diabetes, they lose that arch, and therefore their foot tends to take a very bad form, which actually predispose them to developing ulcers on the foot. So it's all results the ulcers come about as a complication of the diabetes itself. For some people, it may be the time they present with the ulcer that we screen them that we realize that they are diabetic. For some people, they've had it for a very long time, and then they've developed the complication and they develop an ulcer which they are not able to pick up quickly. So it depends. Some people, they actually present with the ulcer and we find out that the ulcer is related to what? The diabetes. Okay, and for some people, it stays with them for a very long time before they develop one. But in all this, if you're able to maintain your good glucose control, good levels of uh, good control of a diabetes, it's unlikely that, or your chances of developing this complication, the diabetic foot ulcer, reduces remarkably. And there's some things.
How then do you control this glucose level then once you've been diagnosed?
Once you've been diagnosed, there are what we call medical and non-medical management or control of this. So for the non-medical aspect, which in fact is what we encourage most patients to do right from the beginning, is to modify their diet. We have dietitians who will be there to advise you. Is to have enough sleep, rest, or 6 to 8 hours a day, reduce activities that put stress on their body, and then also exercise. And make sure that they stay hydrated during the daytime. All these things help to control your the sugar. Then we have medications. There are various forms. They all have
the very common one is metformin.
The common one is the metformin. They all have various ways in which they help control the sugars. Some of them help to increase the sensitivity of the body cells to insulin, so that the little insulin you have is able to, your body cells are able to take it up. Some of them actually help push the insulin into the cells, help the insulin to push the blood into the cells. Some of them actually remove the excess sugar from the blood through the urine for you. So there are various medications that we use to actually control this. Then
sugar.
if all fails, then you can also be put on insulin to help control your sugar for you.
Now, Oscar, I know that Lions Clubs help with creating awareness about diabetes and help where necessary. What are some of these ways that Lions Clubs help?
Yes, so one of the ways is what we are doing now. The other ones, we engage communities through common forums like
Okay.
church. We seek audience at churches. We promote diabetes awareness. We do so at markets. We do so at mosques. Let me indicate that on the 6th of November, we were at the National Mosque at Kaukudi,
Okay.
where we undertook free screening for all the people who were there to worship. We do so also through informing or showing leadership uh, by engaging in health walks, and by so we are telling the public that physical activity helps to improve our health and, for that matter, prevent or manage diabetes. And as we do that, we engage them sometimes with leaflets, sometimes with information, because information is key. So these are the key ways that we do so. Diabetes is one of our 8 key service areas.
Okay. Okay.
And we are so passionate about it such that we devote the entirety of November to the promotion of diabetes awareness, because the prevalence rate is increasing. And like Doc said, the risks and dangers associated with diabetics are very, very, very severe. And if not managed well, complications will come in. And this is what we hope to prevent. And this is what we do as Lions.
How can local communities get involved in this awareness creation?
So local communities can get involved in this awareness through a number of ways. One of them could be to join in a club. We have over 48 clubs currently in the country. If someone is passionate about promoting health, supporting those in need, they could join one of our clubs.
Is that the primary thing that you do, supporting people as Lion clubs?
Yes.
Lions clubs.
As Lions clubs, we promote health and well-being. We strengthen communities, and we support those in need. And so health and well-being, that's where diabetes comes in. That's where vision come in. And then we have hunger, and that's strengthening communities or supporting those in need. We have I mentioned vision, diabetes. We have environment, where we promote the environment or environmental awareness. We also do a lot in humanitarian support. The other thing we do also youth development. So we do this number of things. And so in any way that we can support the community, that we can serve those in need, we are in. And we've been doing so proudly. And like I said, so people could join us to do any of this. If you choose not to become a Lion, you could also volunteer with us. So for example, one of our clubs will be walking up the hill on 30th of November to create diabetes awareness. You could join us as a volunteer to walk up the hill, to exercise, and to spread information on diabetes prevention and management.
Do you think as a country we don't raise enough awareness on diabetes?
Yeah, we cannot say that we raise it enough, because more awareness is needed. And like you and Doc mentioned earlier, the prevalence rate of non-communicable diseases are increasing very, very fastly. And that is regrettably scaring. And so we need to have more and more awareness, because information is key. When you are aware, you are informed. And when you are informed, you take the necessary steps that will enable you not to get into such situations. And information is key to prevention. So we need more and more of that, because sometimes we take things for granted. We develop habits that we are not so mindful of, that could bring health implications to us. So the more we talk about it, the more we inform people, the more we become aware. And once we become aware, we become conscious and become second to nature. And so we begin to develop these healthy habits without making enough effort. And so information and awareness is key, and we cannot at any point think that we've had enough of it.
Now, Doc, let me come back to you. We landed on diabetic wound, right? Is it reversible once somebody starts getting diabetic wounds?
Yes, so if the person gets a wound, we can help that wound to heal and heal as fast as possible. We can help the person to heal and heal as fast as possible. So when you come, we usually will assess you, because we need to know the type of wound you have. whether it's infected, whether it's not infected, whether it's located in a very critical area or not, whether the vessels supplying that part of the wound are compromised or they are okay. We do all this assessment, and based on that, we prescribed appropriate dressing and aids to actually help the wound to heal fast. Okay, then after that, when your wound heals, we also teach you the foot care, which is very important for diabetics. You must make sure that you examine the wound, your foot regularly, because you've lost sensation to the foot. You'll not be able to feel things as people usually do. So regular foot inspection, regular foot hygiene. You make sure that you moisturize the foot very well so that it doesn't become dry and crack easily and it gets ulcerated. When you want to cut your nails, you don't use a blade to cut the nails and you end up cutting your skin in addition to the nails. You use a clipper in this instance. Okay, so all those things with a regular foot hygiene helps. You wear the appropriate footwear. Sometimes when we examine the foot, we're able to know that no, your shoe you're wearing is not good for you. You may need an insole to help protect the arch of the foot and help you developing the foot. We look at all this and then help you to be able to heal fast and be able to maintain the foot without an ulcer.
If all these things you enumerated are not in place, what complications arise if you're treating a diabetic wound?
Amputation, which is what we all want to avoid. Because when someone gets amputation, it becomes a burden to himself, the family, and then the community at large. And these people, someone may be a breadwinner for the family, but gets an amputation and is actually stuck in one place. Now people who depend on him, he becomes dependent on them. And it brings a lot of stress, a lot of economic hardship to the family. So we want to prevent amputation, okay? And even with amputation, we want to prevent the major forms of amputation, okay? You may get away with just removal of a digit, which may not impair your mobility or anything, but when you get your foot or your leg removed, it really limits your mobility. Even though there are processes to rehabilitate such people to get back to their normal functioning level, it's a tall order. And also, in addition to that, it's quite expensive to get them to heal and be able to get back to their normal activity. So prevention is the key. And we want to prevent you from getting your leg amputated.
Is the orthodox way the only way? Can we supplement it with herbal in
So
the treatment of diabetes?
that's an interesting question. I will say that from my training, I know that if you come very early, I can get you to heal well.
How early is your early?
So first, once you get a wound, and you're diabetic, you get a wound, you shouldn't joke with it. We shouldn't go ahead and be applying medications and ointments based on recommendations of people who are not trained to handle such cases. So once you get an ulcer as a diabetic patient, your first point of care call should be at a health facility where you'll be examined and appropriate treatment given. Most people resort to the health facilities as the last resort. And when they come in really bad state. Okay. So that is what I will say about that. But I wouldn't say that the orthodox way is the only way. No, I can't say that.
So for people who resort to herbal medication in treatment, what would you say to them?
I would say that you need to really be critical of the type of treatment you are having. It doesn't make sense to put dirt or germs in a wound to treat a wound. So if you go to a place where they are putting, we've had instances where they've put cow dung or animal droppings in a wound that they are treating the wound because it's a complicated wound. It doesn't make sense. That's common sense should tell you that you don't put dirt on dirt. It will just get infected. And as I said, for the diabetics, they are almost... So if you opt for those treatments, we be very critical of the type of things they use in treating you, the type of medicines they use to, they give you to drink, the type of medications they apply to the wound. Be very critical about it. Some people come with herbs applied and the leg bandaged so tightly that it serves as a tourniquet, and that will even cut blood supply to the wound. Okay, so I've had instances where a patient come and we are not able to do anything because they've tourniqueted the leg off and it's dead. So then that patient would have to have amputation. If somebody says he's treating you and the treatment is causing more pain, you should know that there's something wrong. So you should seek a second opinion.
Right. Oscar, is there anything you want to add as Lions Clubs?
Yes, so as Lions Clubs, we see it as our duty to continue to create such awareness. We'll continue to do so, and we'll continue to ask that the media will continue to welcome us, and the public too.
Our doors are open.
Thank
always.
you. And the public too, we hope that they will also continue to take interest in some of these communicable and non-communicable diseases and how it could be prevented. Diabetes is a silent killer. Like you said, if you do not know someone who is closely affected, you may not know the severity of it.
Absolutely.
So it's good that we do so, and we don't need to have someone so close to understand this. Let's ensure that we are taking steps that prevents it and prevents our friends and family members from getting into this situation. So we serve, and our doors too are open. People who wish to join us as Lions, who wish to volunteer with us, they should look out for our channels on social media and connect with us. And we are proud to say that we are serving a world in need. Thank you.
Do you accept all ages as Lions Clubs?
We have groups of lions. We have Leos and we have lions. The Leos are the junior ones or those in school.
Okay.
So if you are young and you wish to join a Lions Club, or you wish to join a Lions Club and you wish for your children or what to also be part, they could join the Leos. The Alpha Leos are the very young ones.
Okay.
But the Leos from primary school up to university, you could be a Leo. And then for Lions, it means that you are working in active service and have the capacity or the treaties, the talent, the treasure, and the time to become a member. Because it's good to become a member, but it takes time, talent, and treasure to become a good lion.
The treasure, you mean money?
Yes, the treasure means money. Yes.
Must you be rich to be a Lions
You
Club
do not
member?
have to be rich, but you need some treasure to be a good lion. Because we pay dues. Dues is a dollar component and city component.
Hey.
We also have had to, at times, contribute money from our pockets to undertake activities at club levels. And so you need some resources to be able to support, even though such monies raised for activities are voluntary, you feel you'll be promoting our cause if you are able to do so when you have resources. Yes.
Okay, Doc, your final words?
Well, diabetes is on the increase. Most of our patients who come in late because of lack of awareness, and most also come in with complications which are preventable with early diagnosis and management. So we encourage anybody who has symptoms of diabetes to report to their nearest facility for help. And then when they are given treatment, they should stick by it. If they are having side effects from the medications, they should talk to their healthcare workers so that it will be remedied. They shouldn't just stop it, because stopping it will not cause your sugars to come down. They will actually increase it and make you develop the complications, which are preventable.
Absolutely, absolutely. Thank you very much. And please ensure that you are maintaining a healthy lifestyle, which is key. Stop drinking alcohol in excess. Be moderate in your taking of alcohol. If you can stop taking. And Dr. Mebwa.
Yes, if you can stop it, take it. You stop it.
At all.
But everything do in moderation.
In moderation, be be circumspect when you're taking alcohol, when you are eating your sugar, when you are taking your salt, everything you're taking in. Don't say that is available, so you eat it in excess.
Exactly.
Please.
Rest and exercise.
Rest and exercise. That one, dear doctor, I treat me. Thank you very much. That's Dr. Theodore Wadri. He's a general surgeon, Kolebu Teaching Hospital and Innova Wound Care Clinic, and Lion Oscar Onai. He's past president, Accra Harmony Lions Club, and district marketing chairperson. This morning, we've been discussing diabetes, so we want to make sure that we're all healthy and alive. So at every time of the day, you can listen to us here on Simply the Best Station, Starr 103.5 FM.